Late Night Health continues. I'm Mark Alyn, along with Dr. Ken Redcross at the controls, the insane Daryl Wayne. I'm a big baby, Dr. Redcross. I really am. And I also don't like going to my doctor. Is it worthwhile going to the doctor if you think you have the flu?
Oh, yeah. You know, I usually tell patients, look, sometimes it's hard to differentiate between a cold and a flu. So within that first 48 hours, I give everyone a little bit of a longer leash to see maybe you can kind of beat this thing if it's a cold, which tends to be a little slower as it comes on. The flu kind of comes on abruptly and hits you really hard, and those body aches are what kind of clues us in that we may be dealing with a little bit more. So should you get past that 48-hour window and you're really starting to feel like, hey, this is a little bit more, you have to come into your doctor because we're able to test you for influenza, obviously. It's like probably a 15-minute test. If you come in, we do a nasal swab, and you get the answer in about 15 minutes. The other thing is, I want to make sure this time of year that everyone recognizes when you go to your doctor, you're likely not going to leave with a prescription if it seems like it's viral, because the prescriptions only help for bacteria, and so there's no reason to expose you to that and the potential side effects of something that is not, in fact, necessary.
You're talking about antibiotics.
Yeah,
but
antibiotics
a lot of doctors are kind of coerced into giving antibiotics.
Yeah, and it's tough because, you know, a lot of us as physicians, we want to make patients happy, and patients can sometimes feel a little happier when they leave with something in hand. But this is when there's a little bit of an educational piece, when you have to sit down and let the patients know and understand that prescriptions like you mentioned, antibiotics are for bacteria only, that viruses is that some of the things we talked about and maybe a couple of the other things that we'll mention that can help a virus go away quicker, but antibiotics would do nothing. And the antibiotics are not without potential side effects. And that resistance that you and I talked about in the beginning with hand washing, it's even worse with antibiotics nowadays. So we have to be careful and cautious.
I didn't realize that you could be tested for influenza in 15 minutes. Is that it? I mean, with a bacteria, it takes a week for the bacteria to grow on that petri dish.
Exactly, yeah, and the culture of the agar or the media, the petri dish, exactly. Now, so when you get a rapid influenza test, it's pretty much just checking the nasal swab. It can be harder there because it's a respiratory virus, and we're able to at least put it on a little, what kind of a reagent we call it. But the point is, you're able to see if it looks as if you're having influenza or not. Now, we have different types of influenza. The ones that we are concerned about typically are A and B. A tends to be the more aggressive. B tends to be the one where someone says, I think I came down with the flu, but they kind of kicked it in a few days or so.
And what about deaths from influenza? People do die. You mentioned child deaths last year. People can die. It's a serious thing.
It's very serious, actually. In fact, last year, over 700,000 people were hospitalized because of not only the flu, but the complications. And the number one complication of the flu, Mark, is actually pneumonia. Pneumonia is what takes so many lives each and every year when imagine someone 90 years of age gets influenza, and they're trying to deal with fighting a pneumonia, meaning they have less of an area for their lung to breathe. And then you better understand how serious that it can actually be. And so, you know, we've seen the death rates up to 50,000 annually from flu-related deaths. So it's something that we really need to take seriously.
And in looking at the boron product, which I can't pronounce, is that something you should take as a preventative, or wait till you have the symptoms?
Yeah, so oscillococcinum, we can just call it, instead of oscillococcinum, we'll just call it Oscillo, right?
Oscillo, right.
Easy. So for Oscillo, it's something you take at the beginning of the signs and the symptoms. That's why I said that first 48 hours is where the studies showed the best benefit. And usually we know what those symptoms are. I mentioned them before: fevers, chills, and body aches. And even my twins, and they just turned 13 last week, and even they know that should they come down with some of these symptoms that feel like, quote-unquote, a little flu-y, they start it. And they're little micro tablets. They like them. They always like them as children more because they taste a little sugary.
Sweet, yeah, a little sweet.
Easy to take, right? And so only the beginning of your symptoms, not a preventative. The prevention is all the things that you talked about: hand washing, staying away from those people, wiping down your counters and surface tops, because the flu can live up to 12 hours on hard surfaces, or actually up to, it really depends on where you are, but 12 to 24 hours. It varies, so it's a big deal.
What is the number one thing that people should do? You have a whole list, and we've gotten through most of them. In your opinion, if somebody gets the flu?
Well, we talked about some of the symptoms. We have to make sure we're staying home from work. We also need to make sure you get into the office, and let's see if you do have the flu. But then getting back to the natural realm as well, black elderberry extract is interesting. I like black elderberry personally, Mark, in a tea, but it's been shown to be able to boost the immune system and decrease the severity of the flu, so that can help. There's also butterbur. Butterbur is really, it's all about the anti-inflammatory effects there, because it really helps the inflammation in the bronchial tissue to make a difference. There's also holy basil. Holy basil becomes a natural expectorant. So that way you can get up some of the secretions there. And last but not least, when you're towards the end of those flu-like symptoms, Mark, you want to choose two things, R&R. You want to rest and relax, because I don't want you to overexert yourself and go backwards. And so you want to make sure you're getting sleep and making sure you're also getting adequately hydrated. That's
we are also absolutely out of time, Dr. Redcross. Go to drredcross.com, right? drredcross.com. We'll be back. Don't go away.
Thank you, Mark.